Sweden's Foreign Minister Ann Linde. Thank you so much for joining us from Stockholm. We've seen so many countries around the world which have different methods of fighting COVID-19, whether you look at China and Southeast Asia, Taiwan, Singapore, even New Zealand. Sweden has had a big microscope on it in terms of how it's been fighting it. India, on the other hand, has gone into a strict lockdown and is still in that. But you would deny what most experts say, that is, Sweden would deny, that you are pursuing a strategy of herd immunity.
Well, thank you for having me. And I can start by saying that we don't have a strategy of herd immunity. That's false. I would say that we have the same goals as most other governments, is to hinder the spread of the virus and save life, and to take away the pressure from the health care system, but also to mitigate the effects on economy, business and jobs. And we do that in a little different way than other countries, but that is mostly because we are used to having we have big authorities and rather small ministries. And when authorities comes with recommendations, people know that they have to follow it. It's not like a tip that you can choose to follow or not. And we also have legally binding measures, and the government discuss every time. For example, when we decided not to close the schools, it was after the recommendation, and then the government discussed pros and cons, and we decided to keep the schools open.
So when you look back now as to where Sweden is, because many experts still look at the numbers and say in comparison to your neighboring countries, Sweden, Denmark, the number of deaths are much higher. So how do you justify the strategy that you're following?
Well, I would say that in one area our strategy has not been successful, and that is that we have tried to save the elderly group, but that is also a group where we have had legally binding measures. It has since already in the beginning, we decided that it was not allowed to visit any elderly homes, which of course has made it difficult for elderly not to be able to meet any persons except of the personnel. Still, we got the virus inside the elderly home, and 90% of the deceased, the dead, are 70 years or older. Meaning that that is where we have not been able, and we are looking very closely into that now. And today we had a new decision from the government to have 200 million extra euros to elderly care and to better education for personnel in elderly care. But that is where it has not worked. And as I said, there is where we have had legally binding measures. Otherwise, we have managed to flatten the curve. The health system has managed, even under big pressure, but there has always been a rather healthy availability of ventilators, for example. There has been no such problems.
So in terms of figures, I think I was seeing your health system, there is still about 20% capacity still left to deal with any eventuality. Is that correct?
Well, now it's more than 30%. And we have less than 500 in intensive care. But of course, it's still a big pressure. I mean, I don't want to take away the terrible situation also, not only for patients, but also for doctors and nurses. They work 24/7 in a very, very stressful situation. But when it comes to availability and so on, it has worked because we managed to flatten the curve. We also have been looking to what will a lockdown mean for the public health also in the long term. And we think that if you lock people in, there might be consequences like domestic violence, depression, abuse of alcohol or drugs, abuse of internet playing, That is also one area where actually the government has had to go in and stop the possibility to use gambling on internet unlimited. So we have put different kinds of legally binding measures to mitigate that.
When you talk about the Swedish economy, how is that doing? Because the Riksbank itself has also looked at a long-term picture, and it's saying maybe 6 to 10% would your fall in your GDP. But in the immediate short term, how is the economy doing?
Well, there are two things to say. One is that the Swedish economy is taking a hard hit. We will go down more than 6%. EU said 6%, we say 6.5% down in GDP. But especially I would point on the unemployment, where we will have more than 10% unemployment as a result. And we have bankruptcy in especially in the hotels and bars and restaurants and so on. So the Swedish economy is taking a hit. On the other hand, we have one of the healthiest economies when we came into this crisis. We have 21% or debt, national debt. Now we have gone up considerably, but it meant that we had the economical muscles to put in very, very strong measures for business and unemployment. One part in our strategy is also that people who has even very, very mild symptoms should be able to stay at home. So we have normally the business employers, they pay 14 days of sick leave. Now the state pays. We also have taken away the one-day qualification day before you can get your sick leave, and we have taken away the requirement for a doctor's certificate. So all those things to keep people at home without losing out economically on it.
So all in all, because this debate about lives versus livelihood in different countries around the world is continuing to rage, would it be fair to say, when you say that you're expecting a fall in GDP of, say, 6%, 10% unemployment, if you hadn't followed the model that you were following, it would have been much worse?
It could be. It could be. I mean, if you see what the European Union has predicted for different countries, some countries has been very much worse off. But that is not our main strategy is with the goal to save life, and we haven't said that we shouldn't do measures because of this, but that is part of it. But I don't want to say that
it's not a trade-off.
Economic. I don't want to say that. But also, since we have kept all our restaurants and shops and so on open, it is still with a very, very strict recommendation of social distancing. And we have forbidden, for example, the possibility to get bars to serve food and so on. You have to sit down and you have to sit with social distance. We also believe, for public health reasons, that is good for people to be outdoors, to train, to walk, and the virus is not spreading as much outside as inside. So that is also a decision we took, to let people go out as long as they keep social distancing. And it's possible in a country like Sweden.
In terms of India and Sweden, Ms. Linde, we've seen at least a few hundred Swede nationals and Scandinavian nationals as well who have flown out from India. Tell us a little bit more about, it hasn't been so much from the other side, Indians coming back from Sweden, but any information you have on that you can share with us?
Well, actually, I have said we had a very close cooperation with the Indian authorities, because we have managed to get 750 Swedish travelers to leave India on special flights. All in all, we have had 7,000 Swedes who has gone back with the help of the Foreign Ministry. And I myself, I have a very good relationship with the Indian Foreign Minister. And at one time when maybe it was even 2 times, when we had some problems, I could call him up immediately, or we can discuss. And I have to say that he has been very, very helpful. So the relation with the government and the authorities has been great. And also my Prime Minister, Stefan Löfven, he had a talk with
Prime Minister Modi.
Prime Minister Modi to discuss also how we could cooperate. And we have cooperation with the Swedish Medical Research Center, Karolinska Institutet, and the Indian Council for Medical Research on clinical trials of vaccine. So there is also in the concrete area of fighting COVID-19 a bilateral relationship between India and Sweden that I say it is very useful. I think, I mean, I was the Minister of Trade before.
Yes.
And I think that the bilateral relation between Sweden and India has been developed in a very positive way. And as you mentioned before, we had this state visit with the King and Queen, and we met both Prime Minister Modi, and I mean, it was really, really a good visit.
When you were talking about the cooperation between ICMR and Swedish on vaccines, what stage is that at, Ms. Linde?
Well, I don't know exactly what state are in. I just checked that from our side, or from the Swedish, from the Karolinska Institutet, they are very happy with this cooperation. So, but I don't know in what state they are.
It is.
I hope that sooner than later we will get the vaccine.
Yeah, everybody is hoping sooner than later, even though we don't know when this will end. But in terms of Sweden putting in money where its mouth is, whether it's multilaterally in the United Nations or in Europe, you have been, in this particular instance as well as your larger foreign policy, doing that a lot.
Yes, I mean, we, when it comes to international cooperation, we work more on a multilateral than a bilateral way. And we have said that even if some countries, especially one country, don't believe in the World Health Organization, we have an extra $4 million to their fund, and an extra $15 million to the United Nations response, global response for the pandemic. And also in the European response, we have worked more on a multilateral level than a bilateral level. And so it should not be seen as we are not, helping different countries, but normally for Sweden, we prefer to do it in a multilateral way.
So what you are referring to is the US pulling out its money from the WHO. What is Sweden's position vis-a-vis, say, the US wanting accountability from China, from the WHO as well? Australia has come up with a proposal that there should be, say, inspectors that look at it. What's Sweden's position globally?
Well, we agree that we need accountability, but it would be wrong to do it in the midst of the crisis. The WHO need to concentrate 100% in fighting the pandemic. But then, of course, there should be accountability, but not to take resources from their personnel now to answer questions or whatever. That would be the wrong way to prioritize. I also had a long speech, a long talk with State Secretary Pompeo the other day. We had a very good and constructive talk, but we had a different view when it comes to WHO. Well, they have decided to take away their granting, and I don't agree with that. I think that's the wrong way. We have also reallocated, we are one of the countries who has 1% of our BNI to development cooperation aid. And we have made huge reallocations to get more into health systems and to fighting the pandemic in many of those countries where we have development cooperation.
So the differences with, say, Mike Pompeo, the Secretary of State, are there differences there on China as well, apart from WHO?
Well, when it comes to China, we think that there should be they should be doing an investigation on where did this virus come from, how did we handle it, and everything like that. But when it comes to the allegation that this was done by purpose or anything, we have absolutely no evidence or information at all about this. So I can say nothing about that. But we need to have, of course, an investigation done. And I don't think that should be even controversial.
When you're talking about evidence and investigation, just switching tracks in terms of Pakistani origin journalist who had taken asylum in Sweden in the post 2012, I think, because of his reporting on human rights in Balochistan and other areas in Pakistan, who was found dead. Is there any further progress in the investigations? Because a lot of allegations were raised that it's possibly Pakistani state institutions that could have been behind his death.
Well, actually, we are following the death of the Pakistani journalist Sayed Hussain, and that was in Uppsala. And unfortunately, he was found dead. And I know that the Swedish police authority is prioritizing the investigation of his death, but it's up to the police authorities to investigate it. And of course, I hope that they will come with some answer. But so far, we don't have any answer.
Ms. Linde, again, thank you so much for your time. I do believe I caught you in between meetings.
Meetings.
Are they in person or are a lot of them on video like this one?
Well, actually, there are few in persons, but today I will have video meetings. Now I will go directly to a video meeting with my Irish Foreign Minister colleague. And later this afternoon, for example, we will have the 8 foreign ministers from the Nordic and Baltic countries. We meet rather often. The Nordic ministers video conference every week, and with the Baltic together every third week. So there is a lot. I wish I could meet people in person again. I'm really wanting that. So next time I can meet you in person.
Absolutely. It'll be all our pleasure. Again, thank you so much, Ann Linde, for joining us, and do stay safe.
Thank you.